middle income country. So as we have a short time and we have many more to share with you all. So we have a very beautiful and energetic 5 young nurses from all over the world, from 4 countries, and who will discuss about the nursing investment in their perspective in the different countries, that like we have from China, from Indonesia, and from Cameroon, and from Georgia. So I would like to request my panelists that we will share our ideas, and I want to ask some questions from my panelists about the investment in nursing in their territory, in their countries. So we can know that what the world is doing about the about investment in nursing in their country. So I would like to request all panelists, please give your brief introduction so our participants can know that from where you are and what you are doing. So the camera, the mic is yours.
All right. Thank you, Delnasin. I will take my first chance for the introduction, and thanks for opening this roundtable session. So my name is Ariesta. I'm from Indonesia, and I've been a nurse for over 15 years, and now I'm working as the minister's think tank to secure and accelerate the Minister of Health's priority agenda, including the expansion of the cancer care in Indonesia. And next slide, please. I will just make it very short.
Yes, thank you.
Yeah, so in one sentence, I will just describe my work to orchestrate the production, deployment, and quality improvement of the health workforce in Indonesia. Okay, so that's my quick introduction. Tilna, over to you.
Thank you very much. Welcome, Esther, and we will share. So our next speaker is from China.
Okay, thank you, Denisha, and thank you, dear everyone. I'm Alex Liu from China, from Guangzhou, and I'm an oncology nurse from our Sun Yat-sen University Cancer Center. And as you see, I came from the same cancer center with Joyce Zhou. And please, next slide. Yes. Sorry. Can I put the next slide? Yes. I come from the Mid-East of China, and it takes me about 2 hours flight from my hometown to Guangzhou. And now I'm an oncology nurse working for all kinds of medical anti-tumor treatment and tumor drugs clinical trials. And I am a head nurse here working in Department of Clinical Research, and I want to have more chance for our patients to get more another chance to get their treatment. So that's my things. So next to Joyce. Yeah.
Thank you.
Hello, everyone. Thank you for having me. And I'm Joyce. I'm from the same hospital with Alex, and I have been a neuro-oncology nurse for 17 years. And now I'm a head nurse in the Department of Neuro-Oncology, Sun Yat-sen University Cancer Center. And I am pursuing my PhD degree at the University of Macau, and my professional interest is neuro-oncology nursing and psychiatry nursing, and that's all.
Oh, that's great. Thank you. So our next presenter is Anna. Welcome.
Hello, everyone. My name is Anna Maladze. I'm from Georgia. First of all, I want to thank you to invite me. It's a great honor for me to cooperate with you. I'm the first Georgian nurse who takes part in the conference where oncology nurses from all over the world are joining here. Thanks again, your team, for this opportunity. I have 7 years experience for cancer nursing and 10 years of experience as a senior nurse of clinical oncology department. I'm nurse educator too. I'm also Georgian Oncology Nurses Society chairman. I am an ex-advocacy working group member of YONS, and I see a nurse, and I'm proud for this because YONS is changed my life in my career. I gained experience in the clinics of different European countries, which is implemented in my clinic, and I helped the nurses of different clinics to implement the same in their clinics, where the patients would be more able to receive full bowl care. And we were able to do this together, and I'm glad to know that I'm not alone, and there are many oncology nurses by my side in Georgia who are really want to changing the future of the both patients and nursing life.
That's
Every
great.
month, oncology nurses from all over the country meet together with doctors and discuss various topics in the field of oncology. We have different medical cases, works together and improve patient care.
Thank you very much, Anna. That's great, and I welcome you on board. So our next speaker is Veera. Please give your introduction.
Welcome everyone to this 2024 conference. I am Vera Samba from Cameroon. Cameroon is found at the elbow of Africa in Central Africa. I am a nurse working with the Cameroon Baptist Convention Health Services Childhood Cancer Program. I have worked in oncology for over 15 years. With PITS Oncology for over 15 years, I have a Bachelor in Nursing Sciences. Currently, I coordinate childhood cancer services in the Cameroon Baptist Convention Health Services. I am a member of the International Society of Pediatric Oncology, SIOP, and also in the steering committee of the Global Power of Oncology Nursing. Once more, thank you for joining.
Thank you. Welcome, Veera, and thank you for your introduction. As we are in panel, and we will discuss about different things that investment in your countries. So I would like to start with Alex. Please, can you share that how are the nurses in your country recruited to work in the cancer units, and what strategies are used for this? Yes, the Alex. Alex, can you hear me? Okay, Veera, can you share your insight about that? How are the nurses in your country recruited to work in cancer units, and what strategies are used for this?
In my country, we have the private sector and the public service. So I work in the private sector in a Christian institution, and in both, nurses are assigned to the oncology unit. And in my when you're assigned to the oncology unit, you do not rotate. Formerly, we used to just rotate to other units, but now, for like 10 years or 15 years, we don't want nurses to rotate because you need to work and gain experience, what we call on-the-job training, while you are working. So we don't have formal training.
Okay, thank you. That's great, because it's a good strategy to retain your nursing staff in one unit so that it will maximize benefit to the patient. And the same question is from Ariesta, if you want to share.
Right. Regarding the recruitment, it is largely driven by the service needs. So probably I will tell with the two different levels from the national level and also at the hospital level. So from the national level, on the national level, we have a directorate and the Ministry of Health, which is dedicated for planning the health workforce nationally, including the nursing workforce and oncology nursing, based on the priority services with its minimum standard of amount and the level of competencies of each workforce. And also we have the planning based on workload analysis. So the planning results will be then coordinated with the ministry responsible for recruiting human resources, and also with the local governments as the executors. They also have their own bodies to recruit the human resources, and also other authorities. So that's at the national level for the permanent or contractual recruitment. And it applies for the public hospitals, but for the private hospitals, they have like a more loose recruitment scheme. And at the hospital level, it's also driven by the service needs. So they will assess, the hospitals will assess their own service needs to determine how many oncology nurses, for example, are required and in what competencies. However, in general, the recruitments usually set only the basic requirements, such as nurses with bachelor degrees, and they will do the training for the nurses at the hospital or while they're already recruited.
So you have a formulate or the formal training for the nurses who are working in your unit.
Yeah.
Okay, that's great, and I think this worked very well because especially in the low middle income country where there is not recognized training available. So the senior nurses, the trained nurses, they train the junior, the novice, and newcomer, and this will work very well. And I think this is message for all that those who are well trained or those who are working already in the oncology unit, this is their responsibility to train other nurses.
Yeah.
Thank you, Esther. That's a good share. So Alex, could you hear me?
Can you hear me now? Yeah.
Yes. Okay, thank you.
Thank you. Sorry about that. I have mentioned because in our hospital, because we are specialist hospital, so nurses here all can recruited in our cancer patient unit directly. So, but to ensure the quality of care, our hospital and the nurse department will organize. They are really organized pre-job training at the first 3 months for all nurses. Every new nurse is supervised by a senior nurse, and the new nurses are required to pass a semi-annual assessment every half a year. And we also have a policy of a standardization training and certification. Nursing needs to be trained and evaluated to different departments. It's kind of like you need to finish your rotation in different departments, and then you can just decide which department you will work in. Yes.
Okay,
it's our policy. Yeah.
Okay, thank you. And so your nurses are retained in the department in which they are trained. Your nurses, you want to, or you try to retain them in the department?
Yes. Yeah.
Okay. Thank you very much. Anna, the same question with you. What are you doing in your country?
In our country, usually any nurses can work in the oncology department. Nurses are hired on the basis of interviews and tests, and they are tried to directly in the process of the work. Previously, there were no trainings. Now we are approached the association to return nurses in oncology.
Okay. Thank you very much. So you trained them within the unit.
Yes.
Do you have any recognized certificate course of oncology nursing?
Now we have association has 20 hours training for oncology nurses, basic trainings for oncology nurses, And who knows, for example, work with when port cut we don't call in hospital, but we call them in hospital to learn them. But if nurses know all manipulations, we do trainings by webinar, online training.
Okay, thank you. So, Joyce, I have a question from you that we already know that what are the training or the recruitment in China. So, if you want to share about the safety resources are available for oncology nurses are working with the patient with cancer, and do you have adequate PPE for the nurses who are working in the oncology unit?
And thank you. In my region, Guangzhou, China, really nearby Hong Kong and Macau. So I'm so lucky to live in Guangzhou. So which that means that I cannot represent China because it's quite well developed city. So for example, we do have adequate PPE, and in our cancer center, we do have pharmacists or nurses to prepare the chemotherapy medicine. So the nurses in the department or in the ward don't have to prepare the chemotherapy, and we do have the all these distribution center to prepare for us, and we do have adequate workloads.
That's
So,
great.
but I don't think the remote area have this service because we work in the top 3 cancer center in China.
Oh, that's great.
Lucky
That's great.
us. Lucky us.
Yeah, yes, that's great. And Veera, what is situation with in your in Cameroon?
Let me make sure I get you well. I jumped out. My internet got steady. You're talking about PPE, right?
Yes, yes, yes.
We have personal protective equipment. When we started, we didn't know about personal protective equipment, and we didn't have enough enough training. Internet was not so abundant like now. We didn't have enough textbooks, but it is like 14 years now that we have PPE and we use. Now, in our main cancer center for my organization, the pharmacy started reconstituting chemotherapy. It's like 2 or 3 years ago. Initially, for adult oncology, for pediatric oncology, it was the nurses that reconstitute. Now, in other parts of the country, we have small clinics, like where I work. I'm not at the main cancer center. It is the nurses who still reconstitute chemotherapy, but we have PPE that we use.
Okay,
at the level of we don't have a standardized training, but we have we run workshops and seminars, refresher courses, or when we have new recruits, we have those training sessions. So there we learn how to use those materials. We learn how to reconstitute chemo. We learn about safety. Thanks to the SIOP Foundation course for pediatric oncology nurses for Sub-Saharan Africa and many platforms online. Thank you.
That's great. That's great. Thank you, Veera. And Arista, one question from you that do you feel that there is an investment in oncology nursing in your region?
We are like our first speaker, Naima, said, there is 1 in 5 countries with formal oncology training in nursing. We are among the 4 who do not have specialized training for oncology nurses.
Okay.
To say that I think with the attention that the World Health Organization is giving to non-communicable diseases and the projections that we have about cancer, the Ministry of Health is working to invest in all sectors of oncology in my country. Nursing should be in the pipeline, but it is not going to be as rapid as it takes place in other countries. Remember, we have 10 regions. 2 regions speak French. Sorry, 8 regions speak French and 2 regions speak English. So to develop ideas and come from a French background or English background and blend into the other background always takes some time. It is going to get slow, but we go slowly and steadily and we will arrive. But for now, as individual nurses, we try to connect. If I know that there is this institution that offers oncology nursing or cancer care, most of those other institutions will do adult cancer care. We just connect as nurses. If you know one nurse, you greet them, you send them messages, you try to ask how they are doing. That is the way we try to connect. But we hope to get there someday.
Yes,
Thank
thank you,
you.
Vera. Thank you very much. And Ariesta, please, could you share? Because we have short time, so you share your insight about the investment in your region about for the nurses.
Right.
What are you doing?
So in Indonesia, in these past 2 years, and especially starting from 2024 to 2027, the government actually has a landmark program called the Strengthening Indonesian Health Referral Network. So it involves a huge investment in the healthcare sector for the top priority diseases, including cancer, and also for the health workforce that are involved in that care. So to give you a bit of a background, the investment in Indonesia started from the identification of the top priority diseases. So so the government looked at the most life-threatening, debilitating, and also catastrophic diseases, and cancer is among the top 4. But there has been a huge gap in access to essential care. For example, I will take the chemotherapy. At the moment, chemotherapy in Indonesia is only available in 75 hospitals across 66 out of 514 regencies of cities. So it's a huge, it only covers only 12% of what is needed to sufficiently serve the entire nation. And this is especially challenging because Indonesia is vast. Indonesia is an archipelagic nation that if you superimpose the map of Indonesia above the Europe, it will cover the UK to Afghanistan. So it's that huge. So, and it has this 17,000 islands and remote areas in the mountains, etc. So imagine if you were a cancer patient in Papua, that is in the eastern region of Indonesia, you have to fly to Java Island, and it's around 3,500 kilometers, and it's even farther than traveling from London to Istanbul, Turkey. So you can imagine how extremely difficult it is for the patients in many parts of Indonesia to get access to cancer care. And that's just a bit of a background of why the Ministry of Health has initiated this massive service expansion all over Indonesia for top priority diseases, including cancer. And the investment is in total is around 1.6 billion euros. And even though around half of this budget goes towards the advanced medical equipment, such as for cancer services, we allocate the cyclotron, SPECT-CTs, PET-CTs, cytotoxic drug safety cabinets, etc., because they are expensive equipments. But we do have allocate the 20% of it to train the health workforce, including nurses. And this is, so it's a huge investment. Compared to the cost of the trainings of the nurses and the health workforce in general in Indonesia. And this is the first large-scale investment in healthcare and related human resources in Indonesia's history. So the one thing that I would like to point out here is that the investment of nurses need to be integrated or embedded in the investment in the care services. And nurses, as Vera also mentioned before, nurses must be in the pipeline, and it is recognized by the government also. And actually, this project is a short and compact project. It's only until 27, so only 4 years. So for this short period of time, we're focusing on training of our existing workforce, as we'll try to make it as efficiently as possible. And so we only train nurses to cover the needs at the hospitals in their respective cities or region. For example, the training in specific in chemotherapy, radio, or pediatric.
That's great. Yes, that's great, Esther. Thank you very much. And because we will go for our break. So, Alex, please give me a short insight about the investment in your region. The same question with you.
Yeah. Yes, I just hear the answer. And for our country, and for me, I think I'm as lucky as Joyce, because when I came I became a nurse, a college nurse after university in our hospital in 2013. Oncology nurses have already had a very relative mature career development lander in our region. So I can feel the investment in our hospital and from our government, and we kind of started to training our specialist oncology specialist nurse since 2000, and I think it's 8 or 9. Yes, it's very early. And in our hospital, oncology nurse can be a separate nursing specialty, and also it can have many subspecialties now in China and in our hospital. And in our hospital, we have about more than 220 subspecialties under oncology nurses. So it's, yeah. So I can see our government have launched many policies for us to training more oncology nurses, and our hospital give us financial support. And also, yes, if you want to be an oncology specialist nurse, you need to go to pass the open competition from our nursing department, and then you can gain the support of financial and also the time from the hospital is support. Our hospital covers the tuition, the fees. Yes.
Yes, thank you. And what is your Joyce?
Yeah, I think Alex already told the situation here. And for example, in Guangdong province, we started neuro-oncology courses from last year in Guangzhou. So all the nurses were come from public hospitals. So we think we do have more opportunities than the nurses in private hospitals in Guangzhou, and I think that's my opinion.
Thank you. And the same question from you, Anna. That what is your in your region for the nursing investment? Anna, please unmute your mic so you can share.
I don't hear.
Yeah, yes. The same question with you, that what are the nursing investment in your region?
The country has no investor for this at the site. This will require a lot of money. Straight next year, there will be change in nursing. There will be license and credit points for nurses, but not for oncology nurses. There is no specialization yet for oncology nurses. However, our hospital in the country is a leader in the region, and we have the opportunity to train oncology nurses. The Georgian Oncology Nurses Society conducted 24 hours trainings where 59 nurses have already received trainings for different clinics, and slowly this number is increasing, which makes the whole team proud. It is not easy to do this.
Thank you very much, Anna. And it's very great to meet all of you. And we have a great discussion. And I would like to thank you all for sharing your views and what you are doing in your country and what you are doing for the oncology patients. So I deeply thank you all, and we have to take a 10 minutes break so that we can, but we have many more. So join us and continue for this conference, and we have many more ahead to share. So once again, thank you very much, Aresta, Joyce, Vera, Alex, and Anna to join us and share your point of view. Thank you very much.
Thank you.